Hi, everybody. This is Love Him, Love Them with Linda Gunner, where we give hope, touch lives, and change hearts. Hi, everybody, and welcome back to Love Him, Love Them with Linda Gunner. I have an amazing guest with me today. Just want to be sure that if you are interested in finding out ways that you can become involved to learn how you can love others and show your love for Christ, I want to invite you to go to our website at lovehimlovethem.org. Lots and lots of books, resources, and ways that you can partner up with our ministry to take your family to local and international mission trips. We would just love to partner up with you. I don't want to use too much of our time in this introduction because we've got a long, unbelievable story today. And I just want to say this. I had to change my clothes whenever my guest showed up today because they had on a pair of cowboy boots. And the, what do you call your job? The line of work that this guy is in, I did not expect him to show up in a T-shirt, jeans, and a pair of cowboy boots. So we'll talk about that too. Just let you know that every person in the particular line of work he's in, which I'm not going to tell you what that is until the end, he's just a really fun-loving rock star in his field. And also, when you hear these stories, you're going to think that he is supernatural and literally a hero. And I'm talking about like up with Spider-Man and Superman. Okay, he exceeds the expectations of that. This story is, you're going to have a hard time believing that it's true, and that's why I asked him to come and tell it. So I'm not going to call you what other people call you. I'm just going to call you Lee for now. Sometimes people don't like I don't know if you know this or not, but there's a lot of people that are turned off to your line of work. What is the other word for line of work? Your job, your employment? What do you call it?
Occupation.
Thank you. Your occupation. Yeah, so we're going to save that till the end for people to figure out what it is that you actually do. But I'm just going to turn over to you. You're really good at telling your story, and I want you to sort of, the one thing that sticks out in my mind is you mowing grass on a riding mower when you were supposed to be, you had just come out of the hospital, et cetera, et cetera. But currently, you are still battling health issues. Is that correct?
That is completely correct.
Yeah. And when did all this start, and how did it start, and how did you drive here today by yourself based on even your wife said, he can't come without me. He's not going to be able to do anything without me. You know how wives are.
Well, the good thing is that God is great. Right. I know a lot of people use the phrase God is good, but in my case, he has far surpassed good. Yeah. Good is just an average response, and great even has a hard time encapsulating, so true. What God is.
My son Fred asked me about our guest today, and I said, well, the first guy's died like 5 times. Yeah. And he looks at me, he goes, is he dead now or he's alive? I was like, no, he just keeps coming back. Yeah. He just keeps coming back, keeps coming back, keeps coming back. Yeah. So, you are like just the one who doesn't quit, the weeble wobble that wobbles but doesn't fall down.
That's right. And I was looking, when you get a chance and you come close a couple of times, you look back to how it all started, and you suddenly realize that that your whole life has been a blessing, been a miracle. Started out from the beginning, because a lot of people don't know that I'm adopted.
I didn't know that.
And so a thing or two about adoption, and so and you're kind of at the mercy of the people who pick you.
The mom and dad that I know that you have adopted you?
Yes.
Oh, wow. And they're amazing.
Yep. And so I got blessed with 2 of the greatest parents in the world, and that began my blessing journey.
How old were you when you were adopted?
I think by the time all the process was done, I was right at 2 years old.
Oh, wow.
And so
we could do a whole nother show about that.
Yeah, but there have been times when they've asked me if I wanted to find out who my biological parents are, and I said, why would I want to do that? I know who my parents are.
Wow.
Because I think if you go down that road, if you know who you are and you know how you feel about people, knowing what you might find or expect could be something that would be a game changer. And
were your mom and dad? Was your daddy a pastor when he? No, they're not. What were they? What were they? Their occupations?
Well, my mom has always been a housewife because I have 3 brothers, and so she
Were they all adopted?
Nope. They're after they got me. Then
they just popped them out.
Yeah. Then exactly.
That
they
happens
just
so often.
So.
Oh wow. Okay.
And what's really cool is her sister, who lives in Toccoa, has 4 boys too. And her boys start, and then her youngest and I am the same age, and so my grandmother had 8 grandsons that are all like 2 years apart.
Great Saturday afternoons, Sunday afternoons.
Yeah.
Okay, so were you sick as a child?
Not really. There was one time when I was sick, and I can't even remember what it was, but I had to spend a whole summer in a room with whatever it was, and I had to watch through the windows as everybody else got to go outside and run, jump, and play, and that was pretty tough, And then when I was in 10th grade, I had a incident where I had strep throat, tonsillitis, and mono all in one big whack, and so that had me down for a little while, and so those were some of the things that happened when I was a kid, but for the most part, normal childhood,
Were you, speaking of your childhood, were you raised in the church? At what point do you remember, or I'm assuming that Jesus is the Lord of your life?
Exactly.
If you think he's great, if you think God is great.
Yeah.
When did that happen?
Well, like I said, I grew up in the church, and I am so thankful, and it's something that I counsel with people when I do marriage counseling. I said, even if you're not church people, at least expose your kids to it. Let them make their own decision. Don't make it for them. And so, but my parents, we joked around that we had a drug problem. They drug us to church every time it was open, of course, and we were part of the youth group, and, and later on, I became more active in the church, got to be part of the Methodist men's program, and sang in the choir for a while. And
wow.
So, yeah.
I sang on the road with the band. Yeah. Same thing.
So that was strictly volunteer. It wasn't because of talent or anything, I don't think. But but I've always been exposed to the church. But people say, and I went through all the things that kids go through. I went through confirmation, and I stood up there, and and I took my vows and stuff like that. But I think that was a very unrealistic thing that we place on kids. Yeah. Are you going to stand up there on Easter Sunday with 14 other people and say, I don't think so, And the answer is no.
Right. It's more ritualistic, right?
Yeah.
More like everybody else is doing it, so I'm going to do it.
Yeah. I mean, I went through it, and this is what I'm supposed to stand up here and say, and so that's what I did.
Right.
But Jesus really didn't, and another thing about me is I'm a recovering alcoholic. I've been sober for...
I did not know that.
I've been sober for, 42 years now.
Really?
And so, but...
was that pre-marriage, or how many? Have you been married only once?
I had a marriage that lasted about 6 months, which was very unfortunate, but it was part of God's plan because it allowed me to be with the person that I was meant to be with.
So were you
my soulmate.
Were you in... I don't know where my mind is for addiction. Were you in addiction with this marriage?
No.
Or you were done with all that?
She solved my addiction because we went to college together.
Oh,
and so,
okay.
But I got sober when I was
adopted alcoholic. We've got all these A's.
So I got sober when I was 20.
Oh,
and I've never had a relapse or a fallback.
Wow.
And so
was that because of Jesus or not yet?
Probably indirectly. I mean, it was something that was really interesting that happened because, when you find yourself in a dean's office at 10 o'clock in the morning and you're being expelled from school for violating the alcohol policy and being involved in an altercation.
You do call out to Jesus.
Yeah, you do.
Somebody.
Well, at that moment, he asked me, he required me to call and tell him that my mom was at home. And so when I called there, she answered, and I had to explain to her that I had been drinking and that I had been involved in an altercation and that I was being expelled from college and that I would be seeing her later on that afternoon, And in that moment, I didn't think a lot of the moment at the time, but as I went forward, I thought a lot more. I've had a lot of time to think about it since then, but at the end of that conversation, right before I'm fixing to get off the phone, For the first time in my life, I said these words. I said, I've got a problem and I need some help.
Wow.
And,
that's the beginning.
And that was nothing that I would have ever have said on my own. That was something that I truly look back now as that was something that was God inspired. He reached down and penetrated the denseness of my skull and placed that thought in my
That is a great
mind.
book title, Lee.
Yeah.
I've got a problem and I need some help.
Yeah.
That's
And
amazing. So how did we go from there to these insane health issues that you've...
Well, just lucky, I guess. One of the things about being adopted is you don't have any kind of medical history. Oh. And so you don't have anything to warn you to say that, this is going to happen or that's going to happen. And so, a lot of this, could have been things that if I had known what my biological history was, that these were things maybe we could have gotten a little bit of a heads up or a warning on, but we didn't. And so, and so it started out with I had contracted, I got chronic kidney disease. And so I staved off a transplant for about 5 years just by sheer will and dietary and physical activity or exercise. Wow. And I got 5 years out of a kidney. They said wouldn't go 5 months. Wow. And and it was then that that God began to do amazing things, I guess, through me. Everybody said there's no way that's going to happen.
I think sometimes God waits for that.
Yeah.
He's like, okay, we're going. Let's wait till they say there's no way, because then I am the way, and then they'll know I was the way that did this. Because, I really do wonder if he just sits back and says, let's just wait a minute till they realize this is going to be a for real miracle. Yeah. So everybody's saying, no way, no way, no way, no way.
And the thing about it was they said I couldn't make my kidney function go back up, but I did. And he said, I've been doing this for, 10 or 15 years. He said, I've never seen that. I said, well, welcome.
Yes.
Welcome to my world. And so,
did you ever have to get that kidney replaced?
Oh, yeah.
Okay.
So,
which that's not something you can't just go to Walmart and get one. You got to find somebody.
No,
don't you?
Well, actually, we talked to a lot of people about being donors, but on my birthday in 1991, I found out that my function was going down again, and so we had kind of put the process on hold because it'd been 5 years. Yeah. And we'd done so great, and we made the number go up, which never happens. Right. And so, and then all of a sudden the number started going back down. And so my birthday's on December 23rd.
Oh, wow.
And so, I was going to wait till the new year to crank up the process again, but I'd been on the list for the whole time, accruing time. And so I was still on the list, and I was still, I had gone up the list. But guess what? January 2nd, the day I'm fixing to go back to work, we get a call about like 3 o'clock in the morning, and they said, hey, we got a kidney for you.
Oh, wow.
And you need to get here as quickly as you can. How fast can you be here? And so I'm sure that there were a few speed limits that were broken that morning, but yeah, we got down there and got there that day, and then we got the kidney the next day. And
do they tell you anything about the person that you get the kidney from?
No, okay. The transplant process is very, they keep that close to the. I do know that it was a cadaver organ. I know that it was someone who had been killed in an automobile accident.
Wow.
Later on, I did try to reach out to the donor family, and I did that on 2 different occasions. And they chose, I sent them letters, which is all handled through the transplant process, and they get the letters to them. And they chose not to respond to those, but basically the letters were thanking them for their sacrifice, and I told them that I was going to try to be a good
user of the kidney.
Yeah, I was going to be
right.
Do a good job of honoring their gift.
Right. Wow. For real. Isn't that the truth?
So
So after you got the kidney, now everything's amazing. You're healthy, wealthy, and wise.
Well, we just took right off, and that was 11 years ago. And, one of the things that, kind of we knew in the back of our mind that there was a possibility was when you take the anti-rejection meds, one of the side effects is that, long term, if you take them long term, there's a chance that you will inevitably possibly get cancer. Certain types of cancer. And so
from the so you get the kidney, you don't want to reject the kidney, so they give you anti-rejection medicine. But then they tell you when they give you that there's a possibility of cancer from the anti-rejection medicine?
Yeah, they say long term, that some people miraculously don't, but a lot of people do have types of cancer that come up after long term.
What a bummer decision. Okay, so
get the kidney in, and everything kind of gets back to our new normal, and that happens in 91, I guess it was, or whatever it was,
right?
Yeah. And so life is just rocking along, and then suddenly things gets to be 2023, and then things begin to take place again.
So that's when this all started 2 years ago, and that's when I came into your life.
Yes,
because that's when I've heard that it's just been one thing after another thing after another thing after another thing. So what was the first indication of the cancer? How did we know that was what was happening?
Well, the first thing is you talked about the incident at the church. I was over at one of my churches mowing grass, and minding my own business, and I'd been mowing for, 30 or 45 minutes. And I'd already, before I started, I'd been having a cough, and I didn't think anything about it, but I got over there mowing and I got hot and the cough started picking up. And so I said, I'm going to sit down for a minute and see if I can cool off and see if the cough will lay down so I can finish. And so I sat there for a few minutes and then I laid down for a few minutes, and I just really didn't get to feeling better. And the next part of the story is the part that I have caught the most grief for the last 2 years. And that is the fact that, I didn't know I was having a heart episode. Right. So what do? I go over to my vehicle, I open up the back, and I load the mower. Yeah. And I drive myself to the emergency room because it's a Saturday.
Yeah, loading the mower. I think that was the part that most, especially your wife, was not happy about. Okay, yeah.
Why did you load the mower? Well, I didn't know what was going on. I mean, exactly. For real?
Right.
And so I
get to the ER.
By the time I'm walking into the ER, as I'm walking across the parking lot, then I really begin to feel some serious more symptoms. And then, then I had a doctor that was, and I don't even remember what his name was, but, he was trying to figure out what was going on, and now I'm getting shortness of breath, and, so I'm getting in more distress all the time, and I asked him to get closer to me so I can tell him, and then he wants to know what medications I'm on, and I'm a kidney patient, and I've been and so I got all these medications that I'm trying to remember to tell him, and and he's getting frustrated with me, and I'm getting frustrated with him, and I'm telling him, you need to call my wife.
Amen.
And
that's a lesson for all men. Yeah. That would be the easiest thing, right? Just call my wife.
She knows.
She knows everything.
She knows. And so she's like an hour away. She's over shopping in Seneca. And she gets this phone call from the, emergency room. This is Dr. So-and-so, and I need to know a list of your husband's medications. And I'm like, and she goes, what is wrong with him? And he goes, I need the list of the medications. What is wrong with, and if she could have reached through the phone, there would have been, a stranglehold on somebody. But, so, she gave him basically the same list that I was able to give him. And thank goodness there was an ambulance sitting right there in the bay, talk about another God moment. But, ambulance sitting in the bay. So they loaded me up, took me straight to Gainesville, took me straight into the cath lab. And in the next couple hours, I had 3 stents put in, and then I went back a couple of days later and got 2 more.
Oh, I thought you were going to say, and finished mowing the grass.
No,
okay,
that would come much later.
Right. So 5 stents.
So 5 stents. All the blockages. The smallest one was 85. Most of them were 95, and there were a couple that were 100.
Right. So that was the beginning of this. So we go from having to have a kidney replaced to heart issues to, I mean, they just can continue to multiply, right?
Yeah, well, you do the rehab, and then you finally get clear, and I graduated, and I rang the bell, and I got a T-shirt, woohoo, and so things are good again. And then, and then that's in April, May of 23. And then in December, I started, having a problem again, and they thought it was pneumonia. And so I went down and had a scan on my lungs, and they found a spot in my lungs. They also found at that point in time in December, they found a mass on my colon.
Okay.
And
all right. So
now we're jumping from heart to cancer.
So every single body part. So what I want to make sure that we don't miss is, why do you have a smile on your face? Why do you have light in your eyes? Why are you able to laugh? How does someone walk through these insane moments? Because there are a lot of people listening right now that have just gotten that call, that may have just gotten off the lawnmower, whose wife is shopping and just got that phone call. Yeah. How are we supposed to continue, and how have you and are you walking through these insane situations and you still have a smile on your face? Why is there not anger, frustration, and irritation? Or have you walked away from God? What is your relationship with God now through these situations?
Well, I guess, I have to go back to the kidney episode, because when you're in that situation and you're depending on donors and you're depending on a lot of factors and variables, for the first time, I think maybe there was a time before, but that was really a moment when things just really were totally out of my hands, out of my control. Right. And who could I trust, and who did I trust, and who was the only person that I could turn to trust? I said, Lord, it's all up to you. If this is going to happen, I know that you're going to have to be involved, and I'd already started my walk, back, and I did, I did a lot of mission work, and I did a lot of things, in that period, from between when Robin and I married, and this happened, but it was, for the first time, in a long time, I had a peace about it.
Okay, so because you're not in control. Isn't that interesting?
Yeah.
And you know what's funny is we're never in control.
No.
But for some reason we think we are.
Yeah.
And so now we go from no kidney, getting the donor, waiting all this time, things going amazing, putting our faith and our trust and our hope in the Lord, singing a little bit in a choir, and now you're a pastor with 3 churches.
Well, actually 2.
2.
So
okay, I'm sorry, 2.
But that's okay.
And so how do you continue to, when God does not completely heal you, you're not completely healed right now at this second.
No.
Right. So when that doesn't happen, and that's the person that you've put your faith and your hope and your trust in, how do you continue to trust God, lead other people to trust God when that healing has not come to fruition?
Well, I mean, we talk about faith, and faith is something that you really just don't know exactly what it is. It's not something you can quantify until you've had to really, really get down to it and lean on it with everything that you are. And, my go-to motto, during this whole thing this last year has been Psalm 115:1. Which says, you were never intended to get glory, but you were built to give glory. Right. And somewhere along the way, I have just realized that everything that has happened, everything good and bad, God has used to help me. And He knows that, my big thing about now is I try to tell people that just be available. He may not use you every day. He may not use you for a month, but when He says, I need you to do something, be available, and because I'm a recovering alcoholic, because, I'm a kidney person, God has steered me into some unbelievable moments that would have never occurred otherwise if, but he needed me to know, he needed to know that I was available, if he said, put this on my heart, he knew that I would go do it.
Okay. So in other words, you have the opportunity to speak to other people who are walking where you did walk, but you've now already walked through it. And that's who the people want to speak with, is someone that's already gone through the situation that they're currently in.
Yeah.
So where does the hope come from that you have? How do you have hope to give others from these particular situations that you have walked through, and some of them that you're currently in, because you're currently still receiving chemo, correct?
No, I mean,
you're done with that?
Done, and I'm fully in remission now, which is fantastic. But I'm still taking some medications for an fungal medicine from the thing that's in my lung. But I think that the thing that sums it up the best is that the second that I got out of the hospital. I got out of the hospital I guess it was on a Friday, and that Sunday, I sat in church. I'd been making sure that there were people to take care of the duties while I wasn't there. But since I got out of the hospital, I got out on Friday, and so Sunday morning, I'm sitting there on the front pew, and everybody's asking me, Lee, why in the heck are you sitting on this pew? And, and the thing that
Meaning, why are you not in the pulpit, or why are you even here in the first place?
Why are you even here in the first place? Why are you not at home?
Okay.
And I said, something, I said, and God immediately put the story of when Jesus, they had gone, I guess, to Jerusalem for a Passover or whatever it was, and he got separated from his folks.
Oh yeah, and they said, "Where are you?"
And they get 2 days out on the journey, and all of a sudden they're looking around in the caravan with everybody they're traveling with, and they suddenly realize, oh my gosh, where did he go? Mm-hmm. And so they rush back and they look everywhere, high and low, for him. Mm-hmm. And the last place they look is where?
At the temple.
At the temple. And I tell,
his
response was,
where else?
Where did you think that I would be?
Exactly.
And and that's kind of my response. My calling in life is to try to try to be an example and try to share my story and share God's word with people, and I hope that, because of the things that I'm go through, it makes me hopefully more relatable to more people. Mm-hmm. And so, so where am I going to be if I can't sit on the front row of the church and give celebration and praise to God for everything that he's done in my life? I mean, something has to be bad wrong with me if I can't be there and do that. So
can you give celebration and thanks to God for what you've walked through? Are you willing to be a shining example and come back to the church no matter what's happened? I want to encourage you today, and I hope you see that no matter what you are walking through, what you have walked through, just exactly the same way that Lee has walked through all of these particular situations in his life, that we do have the ability to give God glory. He is the one. He is the Almighty. He is the healer. He is the only one that matters. And I just want to encourage you. And if you have been through that, I want to encourage you, like Lee, to encourage others. Because that, my friends, is how we love him, by loving them.